Last week we discussed vomiting. This week it's diarrhea. Cha cha cha. What's the cause? What's the cure? And when should a doctor get involved? Y'all know me, I'm Dr. B, and this is The Buzz. Both vomiting and diarrhea are defense mechanisms with the aim of getting the infectious organism out of the body. Unfortunately, like vomiting, diarrhea can be excessive, leading to dehydration and electrolyte disturbances, getting the sodium and potassium and those sorts of chemicals out of whack. The good news is if your child is just having diarrhea, they can still take in fluids and it makes dehydration a little less likely. Everyone knows what diarrhea is, right? But have you ever thought about how we define diarrhea? It's actually important to define it so we know when there's an actual problem. When a child has diarrhea, they have an increased frequency of pooping. They're pooping more often than they usually do. The poop has an increased fluidity. It's looser and more watery than usual, and it usually has an increased volume. There's more of it. Depending on the cause, the diarrhea may include blood or mucus, and we'll tell you what that means in a minute, fever, abdominal pain, or gassiness. And these sorts of things give us a hint as to what the cause might be. Diarrhea in kids can have many causes, and I like to break it down into short and long-term causes. As far as short-term causes, short-term we're talking about maybe less than 1 or 2 weeks. Infection is one of the most common causes of diarrhea, and it is a short-term cause for the most part. Most commonly, the infections that cause diarrhea are viruses like rotavirus, norovirus, and adenovirus. And I'll tell you a funny story about adenovirus. I once told a mom that I thought their child had adenovirus, and they said, "So you don't know what's going on?" I said, "No, I said adenovirus, not I don't know virus." That's what she thought I was saying. Anyway, viruses are sometimes preceded by vomiting. There may be a little blood in diarrhea that's caused by viruses, but most of the time we don't see that. And viral infections that cause diarrhea are very common in warm weather months, like what we're going through right now. Another kind of infection that causes diarrhea is bacterial infections like Salmonella or E. coli. Not as common as viruses. Often this sort of diarrhea has blood or mucus in it, and it may be associated with fever. And finally, parasites are another type of infection that can cause diarrhea. Parasites like Giardia or Cryptosporidium, these are pretty rare. Often they're associated with cramping, bloating, and a lot of gassiness. And the final short-term cause of diarrhea is medications. Kids who are taking antibiotics, especially things like amoxicillin clavulanate, also known as Augmentin, will very commonly have diarrhea. In children, the long-term causes, and we're talking about maybe greater than 2 weeks, or recurrent causes, can be persistent infections. Often parasites especially will hang around for a long time until we figure out what's going on. Malabsorption problems like lactose intolerance. Someone takes lactose, they might have recurrent episodes of bloating and diarrhea. Toddler's diarrhea, also called functional diarrhea, is diarrhea from kids drinking usually too much juice and it just goes right through them. Both of these problems, malabsorption, toddler's diarrhea, are very commonly worse after certain types of infections. So we definitely want to watch what kids are eating after they have GI infections and make sure that they're not having ongoing diarrhea just because of what they're eating or drinking. And then finally, last common, still pretty rare cause of chronic diarrhea in kids is inflammatory causes like Crohn's disease or ulcerative colitis or celiac disease. And sometimes we'll do tests on kids who have long-term diarrhea because we think they might have one of these problems. And when we get into diagnosing what is the problem, we always start with a good history. And that's why we ask so many questions about something that might seem pretty simple to you, diarrhea. There's so many causes we need to find out where it's coming from. So we'll ask how long they've had diarrhea, whether there's blood or mucus or fever or cramping associated with it. Have they had any unusual foods? Have they been traveling? Is anyone else sick? What kind of things have they been eating and drinking? Next, we'll do a physical. We'll look for signs of other infections that might cause diarrhea. Believe it or not, some kids, when they get an ear infection or they get a sinus infection or just a bad cold and they're drinking that mucus at night, they might have diarrhea from that. And we'll look for signs of dehydration, very important. We'll go over that in a few minutes. And finally, if we need to do further evaluation, for example, if this child has been sick for a long time or if the child looks like they're feeling pretty lousy, we may have to do some testing. Electrolytes are something we sometimes do to make sure the sodium, potassium, glucose, all those chemicals are still in the right balance. But if we have to do electrolytes, we're probably going to send them to the ER because that patient is probably going to need fluids. Stool studies like doing a culture or looking at poop under a microscope, especially if someone is having long-term diarrhea and we can't figure out why it won't go away, just make sure they don't have bacteria or they don't have a parasite. Those are some things we might have to do, but most of the time we can figure it out just from the history. As I said, most of the time when a child has diarrhea, it's just a simple viral infection and it will go away in time without any kind of treatment. So most of the time, the only thing you need to do is watch for signs of worsening illness or dehydration and maintain as regular a diet as possible with a few minor changes. First, we want to cut out high sugar drinks or foods like Gatorade, juices, soda, fruit and syrup, pancake syrup, that sort of really sugary stuff. We want to cut that out. You may want to get the child off lactose. As I said, there are certain infections that can make you have a harder time digesting lactose for a little while after you have the diarrhea. So you may want to come off that, but definitely talk to your doctor before you do that. And breastfed babies should still continue to breastfeed. Probiotics may be helpful in getting your child back to having regular poops. You can get those at any grocery store or drugstore. Usually we recommend Gerber Soothe is a good one, and BioGaia makes some good ones. You can try to look for those brands if you want. Number 3, very important, do not use any anti-diarrhea medicines like Imodium, Pepto-Bismol, or Kaopectate. What your child's body is trying to do is to get rid of the infection. So what happens if you stop the child from having diarrhea? They keep the infection inside them and it can sit there and fester and get worse. I had a kid who took some Imodium to try to stop diarrhea. It definitely stopped the diarrhea, but unfortunately they had E. coli in their gut and it ended up rupturing their bowel and they had to have emergency surgery. So please do not use any anti-diarrhea medicines. What about using antibiotics? Well, a lot of people ask, can we use antibiotics for the diarrhea because the infection might be bacterial? Well, even in a case of bacterial enteritis, bacterial diarrhea, antibiotics are almost never useful and usually don't make the child better faster. In fact, in some cases, like with E. coli infections, treating with antibiotics can cause serious side effects like kidney failure. And if you know anything about kidneys, you know we need those to work. So no, antibiotics are almost never used for diarrhea. And at the very least, we need to get a culture of the poop to see what we're dealing with if we're considering that sort of extreme measure. Parasitic infections are rare, but we do have anti-parasite medicines that will work on them. But again, we need to get a poop sample if we're thinking of using these sorts of medicines to know what we're dealing with. In summary, some small dietary changes and maybe probiotics are useful, and that's usually all you need to do. If the diarrhea persists, we'll need to do some poop studies to see what we're dealing with and see if any medications are needed, but that's very uncommon. So what's the worst thing that can happen with diarrhea? Dehydration is probably the worst bad thing that can happen with diarrhea. Dehydration means that we don't have enough fluid or the electrolytes are out of balance, and so the child's body can't function properly. We talked about these signs last week, but let's go over them again here. The signs of dehydration are pale, blotchy skin at extremities, sunken dry eyes, dry lips, dry tongue, thicker, sticky saliva. They may not make tears when they cry. They may have decreased urine output or have dark urine because it's concentrated from dehydration. They may have a resting heartbeat that is faster than normal, and usually they do have poor energy. If these signs are occurring, the child needs to get checked out, most likely in an ER where the electrolytes can be checked and IV fluids given if needed. The other reasons a child with diarrhea may need to see the doctor, or if they're young age, especially less than 6 months old, I'd be pretty concerned about that. Bloody diarrhea or mucus in the diarrhea, meaning it looks like someone blew their nose in the diaper or in the toilet, that would be a sign that they may have a bacterial infection, which would need to be addressed. Severe abdominal pain or distended belly, high fever. And if I had to put a number on it, I'd say diarrhea lasting longer than a week or two should be seen. As always, prevention is key. We need to make sure everyone's washing their hands and keeping their fingers and hands out of their mouth. Anyone who's sick should be isolated or use a different bathroom. If you're having to change a diarrhea diaper, change the baby in the same place. Use that changing table or choose a place that this is where we're going to change the diaper so everyone knows that's the contaminated area. And please, anyone who's having diarrhea should not be going to school or daycare for at least 1 to 2 days after the diarrhea stops. Thanks for watching today's episode on diarrhea. Please subscribe and hit that bell icon so you don't miss any episode. We put out a new episode every Sunday at noon and sometimes the middle of the week if something exciting happens. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.